thing kicked off here. So good to see you, sir. How are you?
Good. People probably wonder why do they have their webcams on and they have a picture of themselves on a slide. You know why, Eric? I figured this out that on the iPhone, when you're watching a webinar on there, you either see the webcams like we
Yep.
are here, or you see the slide, one or the other. You have to go from one screen to the next. So I think, well, if people are just listening to us, they might want to know who's talking, and there we are.
Absolutely. Well, it's good to see you, sir, and look forward to this presentation day. I mean, Patrick, you kind of came up with the name of this. Why, getting starting a business here at the end of the year, we're still at this pandemic. I mean, are you out of your mind?
Yes.
Okay.
Well, at least my wife says that to me daily. So, I think it's great that I was talking to Dr. Vicki Rackner, who's, by the way, folks, we'll talk about her in just a moment. She's one of our partners, and she will be a partner with you in this business if you get involved in it. Anyway, I was talking to her the other day, Eric, and she said that her business has tripled in 2020
Wow.
from 2019. And as you know, ours has been booming as well. Our licensees are all
Sure.
doing well. So it's just amazing what's happened. And I thought I'd share this picture of my family back in I think this was around 87. That's Adam, my son, who's now the president of the company. And that's my daughter there, Sarah, as well as Linda, of course, my wife. I think we were out at, I don't know, some theme park or something, and we took this picture of us as a family in that year. And I thought, well, that's a good snapshot because that was the year that we actually started doing medical billing for doctors. Linda was actually doing it out of our home. We were in a different home at the time here in Fort Worth, and we were doing so well in that business. Eric, you've heard this story before. People have asked us, well, what are y'all doing? You never leave the house, and yet you seem to be doing pretty well financially. And we started sharing that with them. Well, as more and more people ask us how to do it and wanted to know the details, I thought, well, there may be an opportunity here to help other people duplicate our success by teaching them how to do this. And of course, the hardest part was, how do you get clients? That was the big question everybody asked. Well, look, how do I market this to doctors? How am I going to get clients? I got to have clients. And so I figured that out. As you know, Eric, after several $1,000s and a couple of years really spending time figuring it out, I figured it out. And now we've got licensees, of course, who join us from, like you said earlier, from every background, from coast to coast, every educational background, occupational background, housewives, students. Yeah, we've had even young people join our network, and they're all doing well because they followed our system.
You bet. Yeah. Well, there were some articles that just came out here recently, and I think we did get some of these from Adam and a few from our other folks here. But the important part of here is that there's a lot of entrepreneurs that are looking to get into the healthcare business.
Yeah, I like this quote here from David Cohen, who's the director of a company called Techstars. He says, 8% of all entrepreneurs are in healthcare. Well, that's a big chunk of the economy if you think of how many different business opportunity and categories there are out there. 8% are in this industry because he says, especially because it's a fertile area for founders this year. With the pandemic enforced switch to remote work, we've had to do healthcare online. And as you know, Eric, we taught our licensees a long time ago how to use technology like we're using today to have meetings with doctors and never have to face them face to face. No mask required.
Right, no mask required. That's
Yeah.
for sure.
Yeah.
And then you got some of the leading folks that are investment strategists out there that are saying they're switching a lot of their people in their portfolios to not only tech but the healthcare industry.
Yeah, I kind of highlighted it there in blue. He says we like tech and healthcare due to the pandemic's transformative shifts. Now, Eric, there's an interesting term. We need to start using that. The pandemic is one of those transformative shifts. We've always said that any change in the economy is really an opportunity for our business to grow because it's so tied to something that's so basic, health. It doesn't get any more basic than that. You need food and, you need sex and you need health. I mean, what else do we need? So we're in just the perfect marketplace for people to have a booming business. And that's why this is so important that people realize folks, now is a good time to start a business if you're in the right category.
Right. This was another article that was actually having an article about BlackRock, and in the article that we just saw, this group says, you know what, BlackRock, which is the one that we just saw just a moment ago, again, are pointing their people into tech and healthcare. It's just surging right now.
Yeah, and it's because of the surges in remote working. We've taught people how to use remote working, just like the doctors are using telemedicine to remotely see patients. I have a follow-up visit with a doctor next week, and he said, I said, well, what time should I come in? I was talking to the lady up front. She said, well, no, we're not seeing patients unless it's something the doctor thinks he has to see you personally and examine your body or something. We're doing it all using telemedicine.
Right. Well,
So,
I was going to say, my wife had a doctor's appointment yesterday, and that's what she spent an hour and a half with the doctor yesterday, just not even having to leave the house. So that is a really a good thing to be able to do.
You know, we did a webinar a few weeks back, Eric, that you created this great graphic here. We call it the Corona Cash Flow Crisis. And that's because doctors really are struggling right now with their cash flow more than they were before the coronavirus thing hit, because it's all about, you know, how many patients do they see? Well, they're not seeing as many patients. Therefore, they're in a cash flow crisis even more than they were before I'm not saying we're not praying that the virus stay around. It's just that it's been very beneficial to us and our licensees, our business owners who invest in this business, because their business is booming.
That's correct.
And I found this great quote here, Eric, I had to throw up here. It says, this is from Dave Ramsey, who's written many, many books on money management, as you know. He says, the worst thing we can do is get a second job. The best thing we can do is start a home-based business. So folks, if you're on this webinar today, you're in the right place at the right time, because, well, this is the time to start a home business. If you're thinking about doing it, now is a great time, because again, the economy is just perfect for this type of business, at least.
Yeah.
Okay, Eric, I'll get back there to, let's see, I think we were looking at some of these quotes here from some other books and websites out there.
Yeah,
89% of all physician practices agree that their billing and collection systems need upgrading. Now, doctors do this themselves, a lot of them, you know, they do their own billing, but they all know that they're way behind probably in technology, and that's very expensive to retrain all your people in the office to do that. So again, I think more and more are outsourcing because it just makes more sense from a financial standpoint.
Yeah, absolutely. We've got, you know, obviously we see this quote here from Dr. Rackner. I mean, this is an amazing quote here.
Yeah, she says, this is right out of this book that she wrote here recently, The Myth of the Rich Doctor. Physicians in private practice are from an average of 30% of their incomes. They walk away from 30% of their incomes when they don't follow up on the rejected insurance claims. Now, Eric, that's because the people who work in the office there, when they file an insurance claim, if it gets rejected by the insurance company, they don't have any motivation to go and follow up on that, right? If it's rejected, it just kind of goes into a stack or a drawer somewhere until they can get to it, which they usually don't. So she says, this is written for doctors, by the way. She says to the doctors in this book, outsourcing your medical billing could bring claim rejection rates to as low as 2 to 5%. And that may be the fastest and easiest way to increase your cash flow. Now, remember, doctors are all about seeing patients. They don't focus on the cash flow, but they like to have plenty of it because that's the only way they can grow and pay their staff.
Yeah, absolutely.
Oh.
Well, you know, we broke the webinar down into 4 different areas of why now is the best time to start a business. We want to talk about 4 main areas. Number 1, we know that doctors are in pain. And they're in pain because they have a lack of cash flow themselves. Number 2, we're going to see that the doctors actually themselves, they need a remedy. We're going to show you how you can be the remedy, and then finally how ABS will support you in being that remedy. So, you know, Patrick, I mean, first and foremost, right here, if you go to that next slide there, I'm taking slide 20, you know, we're really seeing more and more doctors that are just in pain. They've got issues bigger than what most folks here on this call have.
Yeah, we found this great chart here. I think it's down there at the bottom. It's kind of hidden. Let me see if I can get that out of there. There we go. It's called Medscape Lifestyle Report. This is for doctors. They did a survey, and this is what they found out. Here are the things that really, really are important to doctors and what bugs them the most. Number one is too many bureaucratic tasks. Not sure we can help with too much of that, but spending too many hours at work, we can certainly reduce their number of hours, because if you're doing the billing for the doctor, they don't have to focus on that. All they focus on is the patients, you know.
Right.
And then feeling like a cog in a wheel, increasing the computerization of the practice, like electronic health records. That's a big hang up for a lot of doctors. They don't understand it or know how to use it. Their income is not high enough. See, that's pretty high on the list there, isn't it? Right. We're talking about cash flow, helping them with that. We can help them with that. Too many difficult patients. Don't think we can do anything about that.
No, can't do much about that.
Insurance issues, of course, we help with that, because that's what we do, is we help collect that money that they've earned from those insurance companies. And folks, it's not as hard as you think it is. You don't have to be a medical coding expert. You don't have to have any background. If you talk to some of our current business owners, you'll find out that most of them didn't have any experience or background in the medical field at all. So we can help with a lot of those things, yeah.
You know, the New England Journal of Medicine, obviously everybody knows what that is. And the reason we're putting this up here, because, you know, for doctors, and if you heard the webinar, I don't know if it was last week or the week before last, when you were interviewing Dr. Vicki Rackner, doctors, doctors tend to want to hear from other doctors. And so the New England Journal of Medicine, obviously a lot of doctors, you know, can trust that. But they themselves will say that the market analysis estimates that 24 cents out of every dollar are wasted on administrative and billing expenses. Patrick, that gets to be pretty expensive over a period of time.
Yeah, think about that. 24 cents out of every dollar that comes into the doctor's office, they're spending on these administrative billing expenses for their people, paying the people in the office. There's a lot of hidden costs that people don't even think about, Eric, that it costs a doctor a lot of money. Not just the software and the connection to the clearinghouse and so forth, but just paying those people that are sitting there actually doing that work. You've got, you know, workers' comp, and you've got other insurance costs on the background, and their vacation time, and all that mounts up. So what if we could do this, folks? What if we could tell you that you could show a doctor that they could go from that 24 cents out of every dollar to only about $6 to $8. I mean, 6 to 8 cents out of every dollar.
Yeah.
You could cut that down 1/4 of the cost that they're spending right now on that kind of stuff by outsourcing to you. Doctors don't realize it, but it's cheaper to outsource than it is to do it themselves inside their own office.
And then we've got this quote here from the physician's practice. Again, we got to show doctors, and this is part of what we would show and teach you, that we're gonna bring in the expertises out there that can help the doctor understand that, like this one says, the greater the economic pressure on a practice, the more viable outsourcing becomes. So again, about outsourcing billing, it possesses processes should ultimately reduce the cost of collections and maximize revenue. Patrick, you would have thought that we wrote this, but that's what outsourcing billing does for a practice. I think doctors understand that.
Yeah, and this is right out of a website that's for doctors. They go here and read this kind of stuff. So folks, the economic pressures, think about that, they bolster the case for the doctor outsourcing their billing. Some of them just haven't thought of it. I mean, they all know that it can be done, I'm sure. They probably know other doctors that have outsourced their billing, but they haven't been shown and educated like we're going to teach you to do. I got to acknowledge this comment here in the question box. It's just a comment, but I think it's great, from Lonnie. Lonnie says, we may be able to help with difficult patients if the reason for the difficulty is billing related.
That's true.
I think I mentioned that was one of the things the doctors had real concerns about, is dealing with you know, patients that are not very easy to work with.
And Patrick, you know, whenever it actually gets down to the billing, I think everybody understands that the doctors will see, let's just say take, you know, today, let's say a doctor will see 20, 25 patients a day. And then obviously the doctor wants to get paid on every visit that they see a patient on. So 25 visits today. is what they would need to be able to want to get paid on. However, in a lot of cases, whenever we don't know about this, is that really only about 70% of that is actually paid, because up to 30% of those claims are actually denied claims there. So that's not coming from us. It's actually coming from the U.S. government, the Government Accountability Office, the GAO.
Yeah. So the denial rate, folks, is when they send a claim to an insurance company, and the insurance company looks at it and there's something that's wrong with it. Sometimes we don't even know what it is. They will say, oh, we rejected that. We deny it. And they don't pay it. And
Right.
those are the ones that come back that I said sometimes just go into a stack somewhere that they don't have time to get to them. But look at that. It can be over 30%. And that is lost money. That's money left on the table for the doctor that they didn't know that they were leaving it on the table, but they did because, well, there it is.
Right.
This is here's a similar quote from the Healthcare Business Management Association. And they say it could be 35% or higher.
Yeah. So folks, let that sink in. That's a huge percentage of money that's left out there. And sometimes it's just never rebuilt. And so this is where the issues are a real problem.
Alan says here, he's just asking the question, well, what is your rejection rate? Meaning, I guess, through our system, Eric. We don't talk about that a lot, but that quote from Dr. Vicky was interesting. She said it could be, you could reduce it to 2 to 5%. Well, ours is less than 2% in our system. And that's because, why don't you explain why that is? Ours is less than 2%.
Well, again, because of the iClaim system that we use, and again, this is why it's important for you to be able to see the this in a live demo. So again, get back with the person that asked you to come to the webinar today and see this, because what we're able to do is capture everything that the doctor's doing. We've got the proper codes, and that would be the proper diagnosis codes and the proper procedure codes built inside the system that actually gets processed. And inside of our billing system, we have one more thing that's usually not in any other billing system, and that's our own clearinghouse. And we're going to show you that here in just a moment in one of these upcoming slides here.
Yeah, and folks, a clearinghouse is usually, that's the big thing that causes that big rejection rate, is they don't know how to handle those claims like our system does, because ours was built from the ground up to have the clearinghouse function built into the system, as Eric said there.
Yeah.
Here's another quote, just one that's similar to it. They say, this is the American Academy of Professional Coders, says that average number of rejected claims averages around 34%. So as we've seen, it depends on the type of doctor, the number of claims they have, the specialty, and so forth. But folks, we've seen several here that have said it's close to 35%. That's a lot of money left on the table. Now, some of those get resent back in, don't they, Eric?
Right, absolutely. Yeah. And then again, on average, 50% of claims are, again, never resubmitted. Just think about that, folks. Let's say that you go out and do business. Let's say you are doing billing and you submit your invoices to the doctor, but the doctor only pays you half of what's owed to you. You know, how long would you truly be able to survive on that?
Yeah, that's right. You would not be able to survive as a business in today's economy, that's for sure.
No. Yeah. And then on top of that, the time getting paid. Typically, it takes about 30 days, and that's if there are no denials. So if there are denials, the doctor can expect payments as far out as 90 days. So again, thinking about all the claims that are not paid because of denial issues, and then you add on time elements to that's whenever, again, the doctors, especially what happened here at the beginning of this year with the pandemic. You've got the pandemic that happened, you know, a lot of things happened, and we had a lot of doctors just almost came to a screeching halt because, again, believe it or not, a lot of doctors are living, again, paycheck to paycheck there.
Yeah, and you know, it's funny, Eric, because I think most of the people on the webinar today would agree, if they've had anything to do with businesses, doctors at all, they would agree that doctors are not the best business people out there in the world.
Right.
So they just don't know what to expect. And some of them don't realize that they're so, I guess, in debt with all the different denied claims and so forth, because they don't really get that kind of information from the people who are working in their office. They're not sharing that with the doctor.
Right.
And that's what makes the difference, Eric, I think, between us and just a typical medical billing company that's out there. We are, as you said earlier, the nation's largest network of medical billing revenue managers. That means that we are the standard that's out there, and therefore we not only have a lower rejection rate, but we have more knowledge as a pool of people because we've got such a large network.
Absolutely. And then we talked about Murmur earlier. I mean, you said that you're one of the co-founders of that. And tell us a little bit about what Murmur is and then really the importance of Murmur as it pertains to our licensees.
Well, the doctors want to know when they're dealing with you that you have been trained and are certified to do the medical revenue management inside their practice. And so this organization was started along with a lot of other people that you can see out there on the site. That's a part of our national advisory board. We started this organization because we wanted to have an organization that could certify and train and make sure that people know what they're doing. So when people go through our training, we tell them by the end of that, you will know more than 99% of all the office managers out there about medical billing and coding. That's because of the way we teach it. And it's all done online, as we'll talk a little bit more later about, but you can do it all from the comfort of your home and never leave home. All right, so Eric, there was the first point we covered. Doctors are in pain. Let's talk about that second one, that doctors need a remedy for all this.
Yeah, obviously the doctors do need a remedy. They need their own pill to take to help increase their revenue, so to say. Well, first of all, what we want to tell you is that you just can't walk into a doctor's office and just say, hey, we know your billing's bad, or we're the best new billing service that's around. What the approach that we want to take is, again, educational and then discoverable. That's the big part of what you need to do. And part of what we do, and you're going to learn how to do this, is do what's called a practice analysis. This practice analysis will allow you to walk into a doctor's office, get some detailed information, go through this discovery, and once you get certain pieces of information, you're going to actually put that into a report. Now, once you put that into the report, which is called the practice revenue report, then you can start to see all these calculations come out. And we've got a bigger shot of that on the next screen there. But again, look at the numbers. I mean, we're talking about the potential revenue impact on a practice. And you talk about increasing the doctor's numbers. This is where you're starting to really make an impact. And you're not selling anymore. You're just showing the doctor by doing a few things differently. Here's the potential financial impact for that doctor.
Yeah, it's amazing. In this particular case, folks, if you were a doctor and you got this report, it was based on the numbers that you had given to a company like yourself. When you come back with this report, they're going to drop down to the bottom line, just like you just now did probably, and see 122,000 extra dollars that you potentially could bring in for that doctor.
Right.
That's increased revenue per year. That's $10,000 a month. Eric, I think any doctor would at least say, you know what, maybe I better look into this and find out how they could do this for me.
Absolutely.
Yeah.
And then we've got
earlier, Eric, that's just one way we bring more money in for them.
That's correct. Yeah, we've got several different solutions for the doctor, whether it's through coding, whether it's through helping the doctor with past revenue issues that they've had in there. But again, what we're going to show you how to do is kind of step through this for the doctor. You don't have to throw everything at the doctor all at once. Whether you're using a sales rep or whether you're using you're going through this yourself, we're going to show you how to work with that doctor and get them engaged and get that information to you.
And we're showing it here with somebody actually sitting next to a doctor. You can all do this all digitally now using GoToMeeting, GoToWebinar, Zoom, all those things that are available to you out there. So we have presentations already designed on your iPad or your computer that you can present to them, just like we're presenting these slides to you today. And it's a wonderful way to engage with a doctor. Then, Eric, let's talk about the fact that we actually do demos for our business owners for their prospective doctors.
Yeah, folks, we had mentioned to you earlier about doing a demo and a live demo, and we're going to show you a little bit more about what that looks like. But imagine having the subject matter experts behind you doing these types of demos for you, right directly for that doctor. So whether you've been in the business 30 years, 10 years, or 10 days, we're going to be able to show you and us do these demonstrations of the software for you to help you win that business. So imagine that we've helped you collect all that data, that practice analysis, put it in that practice analysis report, show the doctor what kind of money that they could gain. But really what's showing is what kind of money that they're losing. I mean, imagine that you could show the doctor that they're losing up to $10,000 a month. Then you come back behind it and let us do this live presentation. We answer all the questions and show them how we can get to that extra $10,000 a month. That in and of itself, again, eliminates what most people think. Well, gosh, Patrick, I can't sell anything. I'm not a salesperson. We're not asking you to be a salesperson. What we're asking you to be is just a problem solver. And part of it is through the practice analysis and allowing us to do that live demo for you.
Yeah, folks, a lot of our business owners just, in fact, on their business cards, they say, I am a medical revenue consultant. Because,
right.
Folks, really all you're doing is consulting with the doctor. Can you help him or can you not? If you can't, then you walk away. If you can, right. It could be that you bring a lot more value to that doctor than you could ever imagine. And we're doing these demos for you at no cost. That's included in your license fee that you invest to get the business started with us. And you never have to pay us for those. We do all of those for you. We answer all the questions for the doctor. They and their staff are sitting right there watching the whole thing on their own computers. And Eric, it's we're at the point where we're closing about 50% of all those demos that are done for our licensees. So
you bet.
It works.
Yeah, you bet. Gosh, we've gone through 2 of these. We're at the bottom of the hour. Let's remind everybody again, if you want to ask us some questions, we're kind of just going back and forth, looking over there and making sure that if there's any particular questions that we need to ask or answer for you, we'll do that. So let's look at number 3, how you can be the remedy for that particular doctor. One of the ways in which you can be the remedy is have a business partner like Dr. Vicki Ratner. Patrick, why don't you talk about how Dr. Ratner really becomes the licensee's business partner?
Yeah, folks, we met Dr. Vicki several years back. We were researching for experts out on the internet that knew how to market to doctors, and we happened to run across a doctor. Yes, she was a general surgeon at one point, and she got into consulting with other doctors and consulting with people who wanted to connect with doctors. So she works with financial planners, CPAs, a lot of different business people who want to connect with doctors. When I ran across her, Eric, I thought, it's almost as if I had prayed and an angel from heaven had shown up, because there she is. She is the expert that's out there. She's written many books, as you see here illustrated. She's been on radio programs and television shows, and she's been interviewed in magazine articles all over the United States. And even today, Eric, she is still flying out to different doctor conventions and speakings to thousands of doctors each year. I told you earlier that her business had tripled this year. That's because doctors right now are they're more concerned about their cash flow than they ever have been. And so she introduces financial planners that help them with their investments and things like that. Well, we have partnered with her, folks, as a partner, because she has written some of these books specifically for us and for you as a business owner. If you join American Business Systems, you too can be a partner with Dr. Vicki Ratner. She has a letter of introduction that she'll give you to introduce you to the doctors in her area. She's written these books that you can put your name and contact information on. And when you do that, all of a sudden you become the expert.
That's right. Yeah, you get to write the forward to the book. I mean, imagine you partnering with Dr. Ratner and having your name on the book. I mean, having your name on any book is a good step in the right direction. And I love what you said, Patrick, in the past, that this is an impressive business card. This is not just a book. It's really showing an incredible presence of some expertise on your side.
Yeah, now this is out there on Amazon, of course, that doctors can order it, but folks, it was written specifically for our business owners. So everything in the book applies to what you can do for that doctor. And as Eric said, we print your name on the cover of the book. Eric, I've had licensees tell me that they've given this book to doctors and the doctors refer to it as, hey, I read your book, as if the licensee or the business owner had written it. They just written the forward, which we already have one written if somebody just wants to put their name on it. But as you can see in this illustration here, your contact information is right there at the end of the forward. So it's like giving out a business card because your contact information is right there in the book. Plus, Eric, I think we have an illustration there of the book with little tabs on there. We teach people how to go through it in our training, highlight certain passages, and when you give this to a doctor with those little tabs, believe me, they'll open those tabs up, every one of them, and read every one of those quotes.
Well, let's talk before you move on from that one. Again, let everybody know that what you're going to learn how to do with these tabs, you're going to be taught during your live online training. The individual that will teach you through this, they have successfully used this technique in getting this information out. And as Patrick said, I mean, imagine you receiving a book and it already has these tabs already there. Well, obviously curiosity is going to get to you. You're going to go, well, why am I going to start flipping through that? So there's really not even any instructions. You're leading that doctor down a path. And inside of that book, there are already parts of that book that you highlight. We're going to show you how to highlight certain parts of those books because, again, we're trying to help shortcut that time for that particular doctor. So talk about an incredible way to go out there and market your business.
Yeah, Eric, I had a licensee that I interviewed here a few weeks back that actually took these books, and we have a certain way that we teach you how to get them in the hands of the doctor. He basically uses a special envelope that we've found that gets it right into the hand of the doctor themselves, past the gatekeeper, past the practice manager, right to the doctor's desk. And then when the doctor opens it up and sees those tabs, they read that book, and he said, I gave out 3 or sent out 3 of them one week, and all 3 of those doctors called him up and said, you know, I couldn't help but read some of those quotes and think, maybe I do need some help. And so they set up a practice analysis with that licensee. So,
and I mentioned this earlier. The reason our iClaim system is so different and it is so unique out there in the marketplace is because what you're looking at right here, and not trying to go into too much of the weeds here, this is the typical billing scenario. You have a billing software that's out there, and in the middle, you have what's called a clearinghouse. You can see that clearinghouse stands between you as a billing company or the doctor's biller and to that insurance company. Whenever you process claims currently, when most doctors process claims currently, they're processing them in a software, then they send them over to this clearinghouse. Remember earlier on in the webinar, we talked to you about claims that get denied. Sometimes they get hung up. If they get denied at the clearinghouse, they actually get sent back to the billing software. Then it could actually get through the clearinghouse all the way to the insurance company. Those claims could get denied there, and then they all come right on back. What we're going to show you here within our system is that our system actually houses the clearinghouse. And you can already see the difference because now, instead of going through some third party that's in the middle between some middleman, you're actually going directly to those insurance companies. And that means that since we're the clearinghouse, we're able to check for those errors, for any claims that could possibly be rejected internally before we even ever send it out. So the likelihood that we're going to send out a claim that could possibly be denied or rejected, it gets eliminated because of the process that's built inside the system. Again, kind of let that sink in whenever you can go out there and be the solution for these doctors and really tell them, doctor, we really do have a way to get your claims that you've been seeing, maybe rejected claim percentages as high as 8, 9, maybe even 15%, maybe even higher than that, really down to 2%. And again, because we house that clearinghouse inside the system, we're able to get those claims directly to those insurances, usually within 24 hours, which means that we're getting a quicker turnaround on that doctor getting paid. So typically we're seeing doctors getting paid within 7 to 10 days. So you put both of those together, less claims rejected, less than 2% of claims, that's 98% of those claims being paid in 7 to 10 days. You've got a real winning combination right there.
Yeah, Eric, I interviewed Jay Beatty the other day. You remember
Right.
he said that he had one doctor, one of his clients, he billed over $350,000 each month for that doctor.
Right.
They've got several specialists in that practice. 350,000. Let's take that down to what's more typical for our licensees. Let's say that you're billing for a doctor, and I'm using a rounded number of $100,000 a month. Now, if the doctor's getting even 30% of those rejected, that's $30,000 a month in rejected money that just he never collects that.
Right.
Well, he collects some of it probably if they resubmitted the claims, but again, we saw earlier that they don't submit but half of those. So the point is, we can reduce that down to less than 2%. And that's
Right.
less than what, $2,000. That's a big difference between $30,000 and $2,000. So more money in the doctor's pocket, and the reimbursements are paid in 7 to 10 days. That's unheard of.
Yeah, absolutely. And then finally, ABS becomes your support. I mean, now that you understand that doctors have a pain, the doctors need a remedy. You can be that remedy, but ABS is basically like, think about it, your remedy for support. We have a whole host of folks that are ready to help you support anything that you need in supporting for your doctors, whether it's how to onboard your doctors into the system, or actually do the billing for your doctor. If you've got any technical issues, you can certainly get help there. Again, we've got a whole host of folks here that help you within all of our technologies and all of our supporting mechanisms that we have here at ABS.
Yeah, we literally have people from coast to coast,
right,
that can help you with support. And that includes some of the licensees or business owners that we showed earlier in this slide here. These are actual licensees that you're looking at here that do help other licensees. When you become a licensee, you now are a part of our network. And these folks, being all successful in their own medical billing business, are willing now to help you and coach you.
Right.
Now, we do being upfront with everybody, we do compensate these licensees for their time, because we want you to learn from people who are actually out there in the marketplace doing this. ABS does not, we don't do medical billing for doctors. All we do is train people like yourself and support people like yourself to actually do that support. So those support centers are, gosh, Eric, I guess with all of our partners, we probably have over 100, 150 people out there that are in the support departments ready to help our licensees.
And we really do have what I would consider to be somewhat of an end-to-end solution whenever it comes down to the billing. Again, you can see that we have the billing system, we have the electronic medical record system, which every doctor needs to have now. That's all built inside the system. The clearinghouse is built inside the system, and the patient portal is built inside of our system. Now, what's unique about our system here, again, also, is not only built inside of the patient portal, we also have telehealth that's already built inside of our platform as well. So imagine that everybody remember whenever the pandemic happened, we were able just to help these doctors get started immediately right in with the telehealth. I think it's that next slide there, right there, Patrick, number 53. So this is all built inside of the system that we currently have. We don't have to go outside of anything. We're literally right here in helping these doctors right off the bat.
Let me address one question here from Elena. She's asking, well, how do I make money? Eric, we haven't really touched on the types of percentages that they would charge for their services to the doctors. Why don't you touch on that?
Well, you're going to be making money on how, whenever you process a claim, you're going to be charging the doctor a percentage. You're going to be usually and typically that percentage is going to be anywhere from 6 to maybe 8% of the total billing or the total reimbursements that come back from each of the insurance companies and maybe from the governmental payers. So that would be Medicare and Medicaid. So typically we want to work with you on each of your doctors that you're looking at doing that practice analysis with. It'll be then where we make sure that you're processing with the proper percentages. We don't want you going in there at 3% or 4%. We really want you to go in there at somewhere at least a minimum of 6%, because that's where you're going to be able to make the money that we've already talked with you about. And when you do that practice analysis and you put that also in that report is already compensated for the percentage that you're already going to be showing the doctor. So those numbers that you're showing the doctor are actual real numbers that also includes what you would even be charging the doctor already.
Now, Eric, if folks on here were paying attention earlier when I said that we had one of our business owners who is actually billing $350,000 a month.
Wow.
And I happen to know that he charges 6% on that. If you do the math on that, folks, that's a nice monthly paycheck for that one client. And we have licensees, our business owners, who have dozens of clients, literally dozens of doctors that they do billing for all over the country. So you can imagine the kind of income that some of them are making. Now, Eric, I'm going to go back here and show just some of the other ways that we support people. One of the things we do is help them with their coding and auditing support.
Absolutely. Yeah, a lot of people are scared. It's obviously in the very beginning, everybody's concerned about whether I can do medical billing because I don't know medical codes. Well, again, those codes are already built inside of the system. We mentioned to you earlier that in the iClaim and the EMRX platform, all of those codes are built there. However, again, if the doctors need specific codes for certain things, maybe you pick up a surgeon and you need to help that doctor need some specific codes for that. Then we have CodeWrite for that. Then we have another auditing support arm of that, which is basically the same coders, but this one's more for auditing. This is more of just kind of doing a spot check for these doctors to make sure that they're not overcoding or what's called undercoding. We think if the doctors kind of not charge as much as that they probably think they can, that's what's called undercoding. There are 5 different, just real quickly, there's 5 different levels of what's called a regular, practice patient visit when you go see the doctor. Level 1, 2, 3, 4, and 5. And obviously level 5 is the highest reimbursement that doctor could get reimbursed for. And so what happens is, instead of the doctors maybe billing at a level 3 or a level 4, they may be billing at a level 2 and maybe a level 3, when really those should be up a little bit higher. But a lot of doctors get in trouble because they're billing at those level 5 visits. That's what Audit Guard will do. It kind of helps see and make sure that those doctors are staying right within the scope of what they need to be able to do.
Yeah, and then some doctors have problems. Well, I should say all of them have problems. It just varies on how bad a problem it is collecting from their patients. Some patients don't have insurance. Some are paying a portion that Medicare doesn't cover or the insurance doesn't cover. And most doctors don't know how to collect that money. That's rightfully theirs, and the patients owe the money. And so instead of going to a collection agency, we have a system that's online, cloud-based, that does all that collecting for them. And it does it and keeps the patients happy. It doesn't make the patients get mad at the doctor's office for trying to collect that. This can bring in a lot of money that the doctors would never see otherwise. We also have ways of helping those doctors with the payments. Some patients need to pay it out. Our Choice Pay service allows the doctor to let the patients pay it out in a way that's acceptable to them. So it just goes on and on, Eric. We have document management support, all the things that doctors have problems with, HIPAA compliance. We've got solutions to all those things. Now, you don't have to offer any of those services to the doctor unless you want to. That's the nice thing, is it's your business. Once you've purchased our license to use it, you can use any portion of it that you want, or none at all.
I was reading Art is saying that 6 to 8 of bills are or the allowable. I mean, if you don't mind, I'd like to figure out what you're trying to say there, and we'll see what we can do to help answer your question there. But again, Patrick, this is all about that support. So folks, we've been talking to you about how we support you. We have all these different services, all these different service lines that are going to help support you. But if on top of that, we have an entire private website just for our licensees. Folks, if you were to go out there today without being a licensee, you wouldn't be able to see anything. But Patrick's going to show it to you for a little bit right here.
Yeah, you'd have to have your own login and password credentials, which we give to you. But folks, this has been out there for over 10 years, and it has hundreds, literally hundreds of documents, articles, videos. Every one of these, when you go into these pages, I'm clicking on one here, for example, you'll see videos. Those videos can be, 40, 50 minutes, an hour more. There's marketing ideas. All the services have their own pages. There's other tools that are available to licensees and resources. Look at all this material, folks. This is something that only our licensees can have access to, of course, but because we constantly update it, here's one we can see right here that we just posted something today on this right here. On this news page. So you can see from looking at the archives over here that this goes back all the way back to, I think it's maybe 2014.
Yeah, I believe so. Yeah.
So that's what, 6 years back in all this. So folks, there's lots and lots of support. We're talking about support still, and that's why it's important that you realize that we're here to support you, and the way we do that is with all the tools that we've developed over the years for our licensees.
Yeah. Art clarified, it's 6 to 8% of the total bill of insurance. Yes, that would be the 6 to 8% of the total bill of what gets actually what's called reimbursed. So yeah, absolutely.
What's actually collected? Yeah.
You bet. Then you got ongoing training and motivation. Again, all the hours that's been spent and invested in the help, the training, and the motivation for our licensees, Patrick, is really second to none.
Yeah, these are videos, of course, that are available to our licensees that we make available to all of them, even though they may have just signed up last week. If this webinar was done last year, it's still out there, and people can go back and watch all these. There are literally hundreds of hours of training that you can do after your initial training, which we're going to talk about here in just a second. In fact, Eric, I put this up here because 2 days from now, on Friday, there is a webinar for our business owners called Supercharge Your Business in 2021. We're going to have a roundtable with, I think, 4 or 5 other licensees or business owners that are actually on there discussing their plans, how they made it through the COVID crisis, and what they're doing for next year. So that's coming up.
Folks, as we wrap up here, I mean, we're getting to the very end, and we've got about 9 more minutes left here. But one of the things that we really encourage you to do, again, is get involved and if you haven't done it already, do a live demonstration. We're going to share that with you. Patrick's going to kind of step you through about 5 steps that you're going to want to do as you kind of start wrapping things up. But Patrick, let's talk about, as people are thinking about it, the investment, how am I going to get this done? And is there a money back guarantee? Why don't you kind of talk through your money back guarantee process?
All right. Well, first of all, folks, there is no money back guarantee in any franchise or business opportunity licensing situation that I know of anywhere. We came up with this a few years back because I said to my staff, folks, if we have what we say we have, let's let people go through our training, see all of our proprietary information and secrets of marketing, get all of our documents, everything that we have, just lay it out and give it to them. And if at the end of our training, they still don't think that this is the right business for them, let's let them ask for their money back.
Sure.
And you remember that meeting, Eric, where everybody was just kind of like their mouths were dropped open, like, what are you talking about, Patrick? You can't do that. I said, well, if we have what we say we have, we shouldn't have that many people ask for refunds. And sure enough, Eric, over the years, we have had a handful of people ask for their money back, less than 0.5% of the people who come through our training. And yet it's real. And we can do that if that's what people want. I did that because I wanted people to feel comfortable. In today's world, Eric, I don't buy anything unless I can return it. That's
Right.
why I buy everything on Amazon.
Absolutely.
Well, the same way is true with folks. You can return everything that we've shipped to you. Just send it back, ask for your money back. We give 100% of your licensing fee back to you if you decide it's not for you.
Right.
So let's talk about those 5 steps, Eric, real quickly. First of all, folks, you want our research guide. This is a 50-page guide that we've come up with information that's not on our website. So if you want that, you have to ask your ABS rep. How do you do that? Well, you get back with the person who sent you this email to get you to this webinar, or just use the phone number at the bottom there. That's a toll-free number. And there's also an email address that you can send that to as well to get that. Then be sure and go to our YouTube channel. It's youtube.com/YABS, and look at all the videos that are out there, folks. There's a whole bunch of them. Once you get to our channel, you'll see that you can sit there and watch videos all day long. So if you're doing your due diligence, just spend some time out there. Third step is to ask your ABS rep for an owner reference list. I mentioned earlier that you could talk to some of our licensees. We have people who've volunteered to take phone calls. These are people who've gone through the training just like you're going to do if you get involved with us, and they've built their business and are successful in it, and we'll be glad to talk to you one-on-one. Then number 4, ask for a live demo. Eric mentioned this earlier. You need to see our software platform, and since it's cloud-based, the only way we can do that in detail and show you to it for real is to log into it while you're watching on a GoToMeeting and just walk through it with you and answer all your questions. Doesn't matter how long it takes. We'll take whatever time you want to ask all the questions you want to. And then the last step is just to lock in your first live online training session. Now, folks, this is all done online, one-on-one with an instructor. This is not somebody who's just learned it from a book, is it, Eric?
Right.
These are people who've actually started their business. Some of our existing business owners who, again, we pay to do the training, but they volunteered and want to do this training for you because they know that it's a successful business that you can be successful in as well.
Yep, you bet. Why don't you put either the web link back up there or the 5 steps? There we go. There's a couple of questions that we can wrap up with here, Patrick. Looks like Graceland is asking, is the system a one-time payment? You want to answer that real quickly?
Yes, that is a great question. We do have a licensing fee. It's about $28,000. You'll see that on our website there, and it breaks down exactly what you get for that fee. But folks, that's a one-time, lifetime licensing fee. Since we have lifetime support, you'll never pay another penny to us for anything ever again. All the training, all the access to our licensee support site that we just showed you, all of the webinars that we do on a regular basis for our licensees, that's all inclusive. And you can even have one other person sit in on that training with you. Since it's done virtually over the internet, that person could be in another city. If you have a spouse or partner or a relative that you want to sit in on this, they can sit in on the training as well. Yeah.
And then I think the last question comes from Lorenzo. How long would it take from training and to get on the route? You know, the training, what does it take? Maybe 3 or 4 weeks at the most, Patrick, if it's kind of split up like that?
It all depends on that person's schedule. Folks, you are the one that schedules this with our instructor. And even though we are here at the end of the year and a lot of people are joining into that training, we still have slots that are open. It's first come, first served. So just get back with your ABS rep and say, I haven't done all of my due diligence yet, but I want that research guide. I want the list of people that I can call, and I'm going to go watch the YouTube channel some, and I'll get a demo from you. Anyway, if you've done all that, then you can get started immediately. I've had people just within 2 or 3 days schedule their first training. Now, these are 10 modules that are about 90 minutes each. So you figure that if you did 2 of those a week, even, you should be able to get through that in about 30 days. Yeah,
you bet. Patrick, well, let's put up that again, the webinar that we're doing next week, and kind of maybe leave that running up there for a little bit. It's about a minute and a half we got left here. I think we've gone through all of our questions, but what a lot of information that we've been able to go through this afternoon. Folks, let's remind you again on 2 major things that you should be doing, or several. You need to be talking to some of the licensees. You need to go through a live demonstration, And then obviously, we highly recommend that you get involved and do a live demo with your ABS rep here. So at least do the minimum of those things. And then join us here for an online training.
Yeah, I look forward to seeing all of you going through the training. Those of you who are on here today, thank you for your time. I hope I can see you next week. And Eric, thanks for putting all this together. It's a good educational webinar.
You bet. Thanks so much, Patrick. Have a good afternoon.
Yeah, you too. Bye-bye.
Bye-bye.